It took me 10 years to heal from chronic back pain. Most of those years were spent listening to people who sounded like they really know what they're talking about. We call those people doctors. Sometimes they're helpful, other times they're useless, and other times they're even less than useless. They're gonna suggest things that might actually turn out to be harmful. In this video, I will let you know how to not be like me and repeat my mistakes when it comes to doctors. Now, this is not medical advice, I'm not your doctor, so I cannot just straight up recommend you ignore everything your doctor said. I mean, that would be useful and it may end up even saving you a lot of time and pain, but I can't do that. So this is me not doing it. I'm not your doctor. This is not medical advice. What I will say though is that there are several major red flags when it comes to doctors. I suggest that if you notice some of these, maybe you want to get a second opinion. Okay, let's do this. Number one major red flag for chronic back pain doctors is that they kind of look annoyed that you're even there in the first place. Of course, they're also gonna look a little like arrogant and smug, but I mean, they are doctors after all, like that comes with the territory. But I believe if you notice like someone is especially dismissive towards you, they're not really like paying a lot of attention to you, they can't even look like they're really super annoyed that you're even there to begin with. I think that's like the easiest major red flag to spot. In that case, I believe you're probably gonna wanna at least consult a few other doctors. And if you're like me, maybe even like bypass the entire process. Again, I'm not suggesting you go ahead and do that right away, but given that a lot of the things that doctors will suggest may end up being not very effective, you wouldn't even be like that much worse for doing that. But anyway, yeah, like if you sense like this air of superiority, like if you sense like really unbearable arrogance and smugness, in some cases that actually may be like this kind of Dr. House phenomenon, like the brilliant doctor is so much smarter than everyone else, like, and all of these like non-doctor mortals, you have to like kind of bow to that person. That can happen, but I actually think that's the exception. Like competent people, they don't really have a lot of reasons to be arrogant. Like their work speaks for their competence. Arrogance is usually like a mask for weakness, for incompetence, which is why I kind of look at it as a major red flag. Again, use your own judgment here. This is just like my personal opinion. I've never really found like an arrogant person, let alone a doctor, to be very good at their job. Maybe you're gonna find the exception. I think this is like somewhat of a golden rule. Number two red flag, and this is like related to the previous one, obviously, is to focus on not just like the attitude you're getting, but also like how much time they give you. Like, are you in and out of the office in like 2 minutes total? You like, you wait in the waiting room. You spend like a few minutes in their office. They may ask like a few questions about your situation, but they're like quick to interrupt you. They don't want to even listen to you. They barely look at you. Maybe they're doing like something else. They're checking their phone. They're typing something in their computer. I mean, I know we get it. Like doctors are busy. They are overworked. But if you get the sense like this person is kind of like whatever you're saying goes through one ear and just like exits on the other ear, like that's usually a really big major red flag for me. And especially like, as I mentioned, interruption. Like if they don't even let you finish expressing your own problems, how can this person help you? You're even trying like to help them do their job, like give them relevant information, and they just cut you off. I don't think that's a good sign. Now, of course, like some people drone on and on about the problem, they're starting to like veer off and they're not exactly giving useful information. It turns more into like complaining. Yeah, I guess like patients also have a role to play here. Do a little bit of preparation on what's the actual important stuff that you need to relate to your doctor. But if they can't even listen to you for like a minute, 30 seconds, like, come on, that's obviously like a bad sign. Red flag number three is painkillers, but not like a regular recommendation of painkillers, let's just say. But if you notice like the doctor is really adamant about maybe increasing the dosage of painkillers, or maybe like going with stronger and stronger painkillers all of the time, and not really like exploring other solutions, you may have run into like one of these doctors that are actually kind of shills for big pharma. I know this can be like a touchy subject. I don't even want to suggest that there's plenty of doctors who are like this. I'm not even sure about the numbers. I do know that some doctors do receive kickbacks from like pharmaceutical companies just to recommend the drugs to their patients. I mean, obviously that's highly immoral. You probably want to stay away from doctors like that. Now, it's normal. It's probably good for you to receive some sort of painkiller therapy, especially soon after your injury. But if your doctor seems to be like this one-trick pony that all they do is recommend some sort of painkillers, and the only variation in the therapy is like stronger painkillers, maybe like a bigger dosage and stuff like that, maybe they have like a conflicting incentive here. This is something you should be thinking about. We live in a cruel, brutal world. It's not even you can't even rely on doctors anymore. And I'm not saying like be super paranoid here, but just like open your eyes a little bit. Just pay attention. Is this person actually trying to find a good, sustainable solution, something that is actually helping you progress towards like the path of healing, on the path of healing? Or are they just maybe trying to get you addicted on some painkillers, which is insane in my opinion, but this does happen. Like, this is the reality of our world, so you do need to be a little careful here. Number 4, and this is also kind of related to the previous point, be wary of doctors who are kind of too quick to pull the trigger on suggesting surgery, especially for issues like, I would say, degenerative disc disease, maybe herniated or bulging discs, or anything that's like commonly known to cause chronic back pain. In a lot of cases, surgery is like the absolute last-ditch effort, and some doctors may be right to suggest it, but keep in mind, this is like a really risky thing. It's a really risky procedure. Like, the surgeons are operating close to very sensitive tissue, nerves, the spine. This is really critical tissue in your body. If they damage it, the consequences of the operation can be like much greater than any pain you're even going through right now. And the irony is, like, there's a lot more, much better, much more like simple, beautiful, easy solutions to problems like this. You probably don't even need surgery, if I'm being honest. Again, I'm not in a position to let you know if you need surgery or not. I think for a lot of people, it's probably not a good option in most cases. By the way, I talk a lot about this in my free book, not just surgery, but all the other things I mentioned. I cover a lot about what worked for me, what didn't work, and how to craft like a meaningful strategy that's going to be custom tailored to you, to your life, to your specific injury, and to your lifestyle. This is a resource that I created for people that I just know what your guys are going through. Like, I spent 10 years in horrific back pain. A lot of it was like really brutal. I don't want people to suffer needlessly. I think this can be a really valuable resource to you. Go check it out. It's completely free. The link to it should be in the pinned comment or description. And last major red flag to look out for in doctors treating you for chronic pain is if they're not exactly healers. There may be doctors, but they're not exactly healers. Okay, what do I mean by this? Maybe you've seen me talk about this distinction in other videos of mine. I talk a lot about this in my book as well. So again, check it out, completely free. But I make like a kind of like a personal distinction, because I went and saw like a lot of doctors and medical personnel, but I also talked to like a lot of people who are not officially doctors. They don't have the diploma, but they were still very beneficial for my like healing journey, healing process. And I think a lot of that had to do with just the level of empathy they showed. And on the other hand, like, doctors, they usually are not very empathetic. And I get it, like, I understand. Doctors probably deal with like several dozen patients a day. Maybe the empathy tank, like fuel tank, runs out. This is perfectly understandable. You can't really expect like someone to deeply care about every patient they treat. But this doesn't change the fact that empathy and care and showing people that you really want them to get better, this is really helpful. This is more helpful than some of you might imagine. I promise you, like, this is something you're not even thinking about. But if you spend like a decade struggling with this, you're gonna come to realize the importance of it. And look, like, not all doctors should be like this. Like, I strongly believe that, let's say, surgeons who do like critical, difficult operations, they probably shouldn't be thinking too much like, oh, does this patient feeling good? Is this like the right place to cut? Like, they should be really certain and confident. They should even be more like on the psychopathic side, I believe, and less on the empathetic side. But doctors who kind of have to like listen to your problem, to diagnose it properly and correctly, to suggest like the right non-invasive solutions, and which often involve like not just drugs and medicine and medical procedures, but often the solutions are much softer. They're more like lifestyle mindset based. This is actually what's going to help with chronic back pain a lot. In those cases, you want your doctors to be fully there, like locked in, and giving you a lot of you just get the vibe that this person is actually listening to you, paying attention to you fully, and is focused on solving your problem. You want to feel like, okay, this person, I can trust them. They're actually here with me. I can share my problems, and they're gonna give me the best possible solution. No conflicting incentives, no distractions, like just what works. We set a pretty high bar for doctors in our society, rightfully so, I guess, because it's a difficult job. But and I actually even think like maybe doctors should be even more compensated, and they should get like more respect. But on the other hand, like I went to more than a dozen doctors, and I never even had like one semi-decent experience with when it comes to like the chronic back pain doctors. Like, is it me? Maybe it's me. I don't know. But why can't you even suggest one thing that works? It was really strange to me. I'm kind of critical of doctors in a lot of my videos. I believe I have some justification to do that. You don't necessarily have to be that right away. Give your doctors like a proper shot. There's tons of them who are really great at their job, and I hope your doctors are like that. You're gonna have a much easier time healing. In any case, even if you have a good doctor, a great doctor, definitely check out the free book. Once again, completely free. No reason for you not to check it out. You're gonna see what worked for me, what didn't work, what I suggest you do, even after like all the recommendations and solutions of Western medicine and regular mainstream doctors fail you completely. Also, I'm releasing a lot of other resources they're gonna help you for back pain. We're gonna have an app for back pain. I'm also publishing a really deep dive course with all of the techniques, strategies, methods that I use to heal. I'm gonna show you everything in really detailed, nice videos. You're gonna see a clear path forward and how to make a complete perfect strategy that's prepared just for you and just for your life situation. My name is Mate with Real Deal Heal. Thank you for watching. Like this video if you found it valuable. Share it with someone who also might be struggling with back pain. Obviously, subscribe and hit the bell thingy if you have back pain, because I want to release like a ton of free videos. I went through a lot of stuff, so I have a lot of first-hand experience here. I believe you're going to find a lot of value in these resources. Questions and comments in the comment section. If you want to keep binging on videos like this on this topic, I think something relevant is going to pop out somewhere around here. Definitely check that out. I'll see you there. And until next time, be brave.